Welcome back to Body Beautiful. I'm Janelle Marie, and we are talking with plastic surgeon Dr. Joseph Mealy about all kinds of procedures today. And right now we're going to talk about gynecomastia. So for those people who don't know, what is gynecomastia? Right into it.
Gynecomastia is breast reduction for men.
Oh!
So sometimes men will develop a little bud, most commonly at puberty. Usually we'll wait a couple years to see if it goes away, but about half the guys end up stuck with it. So we can remove it and make things flat.
And it can also be a weight problem, correct? If a man loses a bunch of weight?
It can be, and if they lose a lot of weight, sometimes the skin is loose too, and that becomes a little bit more complicated.
So you might have to do a little lift?
Might have to do a lift, yeah, might have to remove some skin.
Let's go to picture number one.
But most of the time it's like this. So this is a healthy young man who has fullness in the lower part of his breast that sticks out. So on this sort of that lateral view, you can see on the left chest, it's really projecting, and it makes it hard to wear a shirt.
Yes.
So usually, patients like this will wear a couple shirts and then maybe a sweatshirt over it to disguise it, which is tough when it's 100 degrees out.
Oh, yeah.
So in San Francisco, maybe it's easier. It's harder across the bay.
So what are the procedures?
And then there's a view. The front view also shows the same person, and what we've done is taken out that extra stuffing. So I did a little bit of liposuction through the axilla, through the armpit, and then made an incision from 4 to 8 o'clock right underneath the areola, which is that pigmented skin around the nipple, which is right out in front, but it hides really well.
It hides really well. You can't see it at all.
And you can see the nipple shrinks. The left nipple now is shrink, and it also raises up and looks a lot more symmetrical.
So a lot of men will come in this because they're uncomfortable. Maybe they're wearing a shirt and everything rubs and they're just uncomfortable. It doesn't look right, right?
Yeah, sometimes it'll rub the end of the nipple kind of raw.
That's not good.
That doesn't sound good.
No. All right, picture number two.
So this is a guy with a bud. So the upper part of his chest is perfectly normal, but down below the nipple, you can see there's that extra pooch.
That's it.
And it's just a little breast tissue. There's really no fat there. It's just breast tissue.
So what did you do?
So in cases like this, I just make the incision, pull out that extra tissue, and takes care of it.
What's downtime for gynecomastia?
Downtime, a couple weeks. Most people, the first week, I try to have them slow down so they don't get any bleeding or complications. After a week, they're feeling good. Most people, the first couple of days, they'll take some pain medicine.
That's it?
After a couple of days, they're taking Advil. And, by a week, they're off of it.
What about swimming?
Swimming just has to be healed. So usually I keep people from swimming until I see them back about 6 days after the surgery. If everything's sealed up at that point, they can usually go, usually in a week.
That's not bad. Next picture.
So this is a guy who's a really good shape. You can see all his muscles, everything's strong.
So what was
You're probably
going on?
wondering, why am I operating him? And especially on the operating table, people lay down, it looks flatter. And then my staff is like, why are we here? Because he looks really good. But if you look at that far breast, you can see it's kind of coned out. So he's got a bud of
just on that one. That's it.
And for folks who are bodybuilders, when they lean out, that becomes more apparent.
Oh, yeah.
And it's kind of a stigmata. Even if you're born with it, people are going to assume you're doing steroids.
Oh, okay.
We get rid of it to make it flat and smooth, and then you don't have to worry about it.
And so in the next picture, I mean, these are all very natural. I don't see any scars at all, so it hides nicely under that areola. That's fantastic. And then the next picture.
So the last guy, he's got a lot of asymmetry.
Oh, yes.
So I asked him, if both sides look like the right, would you be here? He's like, no.
Really?
But the left side is just so out of proportion, and it's strangely below the nipple.
It is.
So it gives kind of an odd shape to the breast.
So what'd you do?
Simple. Just do some liposuction, get rid of most of the tissue there, and then there was a little bud left, so I did make the incision and take that down.
And now, can you wear a tight shirt after this? I mean, a lot of guys want to wear the tight shirt, maybe if they're running and stuff, so.
Sure. What I do is I have them wear a tight vest for a couple weeks, day and night, and then after that, for 4 more weeks, half the time. So that gives them support, keeps everything smooth. Just for the recovery. Keeps the swelling down, keeps the skin smooth. But usually after a couple weeks they can run. Sometimes they'll want to keep the vest on while they're running. What
is a good age for gynecomastia? This can happen, you said it starts at puberty. So then what are age ranges?
If I see someone who's 11, 12, 13 years old, I would recommend waiting a couple years and see if it goes away. If it's asymmetrical, like it's all on one side, probably worth seeing the pediatrician, make sure there's not something else going on. It's not a, if it's benign, I'm not gonna have to worry about it. But if it's a tumor, don't want to wait a couple years. So if it's been there, it's established, it's not really changing, then it's a good time to go ahead and remove it.
And you put that patient out, correct? Are we out for that?
I do, with the exception of the little bud. Sometimes you just do that under local, but if I'm doing lipo of the whole chest, I just feel like I can kind of beat them up more and get a better result and not have to worry that I'm going to make them uncomfortable.
Exactly.
Even if you have a great result, if it's a horrible experience, it kind of takes the shine off of it.
It does.
And it's safe. We have a real anesthesiologist there. They're watching, making sure that they're breathing and everything's good.
All right. Well, thank you so much. It goes so quickly. We got more, though, on Body Beautiful, so keep it right here. If you want more information, call Dr. Mealy, 925-943-6353, or check him out on the web at either drmealy.com or sanfranciscobreast.com. Keep it right here on Body Beautiful. Lots more to come.